We're ready.
All right. Hello, everyone. Good afternoon, and welcome to the 8th Annual IHI Inland Empire Coverage and Health Initiative Legislative Forum. I'm Allison Elsner. I'm chair of the IHI, and I'm also executive director for the San Bernardino County Medical Society. We are very excited today as this is our first virtual forum, and obviously we have an amazing turnout. We have around 100 people joining us today, and this is going to be a really educational and enlightening session from top policy and legislative experts and our elected officials from all levels of government. So thank you all for being with us. Before we jump into the Ledge Forum, I just want to take a minute to recognize something that's probably on all of our minds, and that is today's date, which is September 11th. And I want us to recognize a special yet somewhat sad meaning behind the day. As we know, 19 years ago, the United States experienced the worst terrorist act in our country's history. And today we continue to honor those 3,000 lives lost. Even though it was a horrific day in all of our lives and our culture, it's also unified us, which is something that we should keep in mind that we need right now more than ever. Beyond that, the one thing we can do is continue to work together, I think, to make this world better. Sometimes it involves patience and compromise, and today's legislative forum and the amazing work that all of our elected officials and policyholders are doing, as well as what all of you are doing, simply by engaging at the level you are and the good work you do every day. These are perfect examples of how we can make the choice to join together to bring about positive improvements in our society. So I think it's important to look at the good that comes out of things as we look back on this special day. So anyway, today's theme for our legislative forum is addressing COVID-19 challenges in the Inland Empire, federal, state, and county leadership working together. First and foremost, we want to thank today's very generous sponsor, Molina Healthcare, for making this event happen. Molina today is represented by Cameron Smythe, Vice President of Government Affairs. So Cameron, thank you for your incredible support and for being here with us. Would you like to make some remarks?
Sure, thank you. And I'll be very brief, but we are certainly happy to be a sponsor of this forum. IHI, the mission of IHI and Molina very much go hand in hand, and the commitment to the Inland Empire is something that has been important to Molina since our founders first put this company together. And when I saw the list of panelists, I was very excited to be a part of that. I know firsthand the work certainly that Supervisor Perez and Congresswoman Torres have done in their commitment to the community, because we all served together at one point in the California legislature. And since I've moved on to the private sector, we've worked very closely with the senator and the assembly member. And I know you all know this, but I just want to reaffirm the commitment that they have to their constituents, to the region, is at such a high level that the IE has tremendous representation and great advocates for you in Sacramento and DC and at the county level. So we're very excited to be part of the program. Sorry we can't be together in person, but the topic of the day certainly presents why we can't, but still a great opportunity, and what a great turnout to hear from our legislative leaders. So thank you very much for putting this together and letting Molina be a part of it. We're very excited.
Well, thank you so much, Cameron. So let's give you a round of applause. Everybody join me. Yay.
I can hear it. I can hear it.
You can hear it and see it. Good.
That's
good.
Right.
Well, thank you. For Molina is an incredible partner, and obviously you're represented on our board and our advocacy task force. So thank you for the kind support in many other levels too. All right, so we do want, speaking of the advocacy task force for the IHI, we do want to thank that body for their hard work today in putting this event together, including Kevin Mahaney of St. Mary Medical Center, Gary Rotto of San Diego State University and Borrego Health, Lenny Pepper of Borrego Health, Danielle Kelkenstein of United Way of California, and Alexandra Bravo of Molina Healthcare. And a quick shout out to the IHI board members I get to work with: Alexandra Bravo of Molina Healthcare, Lisa Schifano of the Riverside Office of Education, Gary Rotto of San Diego State University. You're a busy guy, Gary. And Kevin Mahaney of St. Mary Medical Center, and Ronnie Robinson of First Five, San Bernardino. Really quick reminder, as soon as we finish our wonderful panel, we would love to save a little time for some Q&A from all of you. So please be sure you utilize the chat feature, which is on your dashboard at the bottom of your screen, and just type in your question, and we will have Soteria Cobb from our staff facilitate questions and direct them to those of you that are indicated in the questions. And we'll get through as many of those as we can. This will be recorded, and I think we'll probably be able to put it up on the, I'll need to confirm this with Victoria, but we want to put it up on our IHI.org website, and we'll put it up on our sbcms.org website at the end, so you can go back through it or share with people. I also do want to extend a huge thank you to our consultant, Victoria Stephen, who is just there through thick and thin and keeps this IHI engine running. So Victoria, thank you for all you do behind the scenes and even in front of the scenes when we pull you out in front there. So thank you, thank you. All right, so I don't know if any of you are Below Deck fans, but as Captain Lee would say on Below Deck, let's get this party started. I'm a Below Deck fan. I need to let you all know Supervisor Perez, unfortunately, has been called away. He's ill, and we think everything's fine, but he had to go to the doctor today. So Gary Rotto, this busy man, is going to be facilitating our panel and our presentation today. So Gary, thanks for stepping in for that. And let me go ahead and introduce Gary Rotto to you. Gary Rotto is on the faculty of the School of Public Health at San Diego State University. Gary teaches the graduate level health policy class, as well as hosts the If I Could Change One Thing podcast of the School of Public Health. This semester, he's been asked to teach a course on pandemics, How to Survive and Thrive, within the Weber's Honors College of San Diego State University. Gary brings an unparalleled background in health policy to the air, with experience directing policy for elected officials at the state, county, and city levels of government. For over 10 years, he has impacted health policy on behalf of community health centers working in FQHC settings in policy and advocacy. And just a reminder that Gary does serve as a consultant right now with Borrego Health, and he's been a champion of the IHI for many years, serves on the board, and he is the, in previous capacity, served as the Vice President of Government Affairs for Borrego Health. So he has, pardon my cell phone there, he has a broad experience in this and has really championed this cause for some time. So Gary, we're going to turn it over to you, and we thank you and look forward to our
Sure. Thank Allison. First, thank you for your leadership as president, the chair of our board of directors and of our organization. And I appreciate the opportunity to step in for Chairman Perez. I'm sorry that he can't join us today. As you heard, he came ill and is at the doctor's office right now. I will channel him a little bit during this, because during my time at Borrego Health, during then Citizen Perez's time at Borrego Health, when he was the chief government and public affairs officer, I was his vice president. I basically served as his chief of staff. So I've had the pleasure of working with him and know how passionate he is, his career in healthcare with Borrego Health, in the legislature, and now on behalf of the Board of Supervisors. So I know that he's very sorry that he would not be able to join us. I am going to first mention briefly our panelists, and I'm going to do a fuller introduction of them when we do the panel. We're pleased to have Congresswoman Norma Torres, State Senator Connie Leyva, and State Assembly Member Eloise Reyes with us. Fantastic panel. We'll be able to talk specifically about this, the leadership and working together, how important it is for all levels of government in responding to this type of emergency. But first, I want to introduce our lead speaker, our keynote speaker today, and that's Dr. Erin Gustafson. And Dr. Gustafson currently serves as the Interim Public Health Officer and Public Health Medical Director of Communicable Disease for San Bernardino County Department of Public Health. She received her medical degree from the University of Kansas, and she completed 2 years of residency training in pediatrics at CHOP, Children's Hospital of Orange County, and UC Irvine. And that was before her passion for population health leading her into preventative medicine. During her preventative medicine residency, she obtained a master's degree in public health from the University of South Carolina. Before coming to San Bernardino County, Dr. Gustafson served as a deputy health officer and then as health officer for Leyva County. She has been of great importance and guidance to the county's response and to our region's response in regards to the epidemic. And I'm pleased to ask her to share a few thoughts and observations that she has over the last number of months as she kicks off our forum today. Dr. Gustafson.
Thank you, Gary. So good afternoon, everyone. I know this has been a confusing and an anxious time for these past 6 months, everyone experiencing this pandemic. I think one of the things I've seen, I know that it has been confusing, especially for our lawmakers and our local officials with the metrics that we're using to open our economy. In the beginning, we had the county monitoring list, which San Bernardino was on since June 21st. And we had been on that list, and now we have a new system, which the governor has introduced, the blueprint for a safer economy, which uses tier colors. We are in the purple tier, which is the most restrictive tier, and then we would move on to red, and then orange, and then to yellow. Most of Southern California right now is in the purple tier, except for Orange and San Diego counties. So it has been a little confusing to grasp some of the measures that the state has been using, especially for all of our lawmakers and for the public to see how this is going to impact our economy opening. And I hope that, I know that over these months, I think some of our citizens have come to see public health as the enemy, which I hope can change, and that they would see that public health and lawmakers would see that public health is trying to just protect the public, and that we understand that people are hurt by also the economy being closed. But with this framework, we have been improving in recent weeks. The state has reduced the number of metrics that they're using in order to determine how we can reopen businesses. And so right now they use the percent of positive test results in the county, as well as the daily new case rate. They are also using a measure where if we are currently, they look at the state testing average, which is at around 2.17, and right now our testing average is around 1.62, and the state initially kind of demonstrating how things have evolved, and it's kind of a moving target. It seems that in the beginning we thought there'd be an advantage for being above the state testing average, but now we also see that there's going to be a penalty for being below the state testing average, where, for example, if we are 25% below the state testing average, the state would take our case rate and multiply it by 1.1, essentially making us have a higher case rate due to lower testing volume. If we have a higher testing volume, they would multiply our case rate by 0.9, which would give us a lower case rate and allow us to move into less restrictive tiers of opening. So we would like to encourage the public to get tested. We know that there have been less citizens wanting to be tested in over the past month. So just want to emphasize that testing is available, and it could potentially help us. And for people, if they are tested, this could help us move on in our tiers, which we are approaching getting able to we do have to meet the criteria for 2 weeks to move on to we'd have to meet the criteria for the red tier for 2 weeks before we could officially move into that. And then we have to be in a tier for at least 3 weeks before we could move on to move on to a tier. So I think another area that was brought up as a potential interest is the healthcare surge, potential shortage of PPE and testing supplies. And I know that we do have calls with the Hospital Association each week, public health and also the EMS, Emergency Medical Services Agency. As health officer, I'm part of the MOHAC, what's called the MOHAC, the Medical Health Operational Area Coordinator. In addition, I work with the EMS agency administrator with our ISEMA, which is the Inland County EMS agency. And so if facilities have requests for PPE or for staffing that can't be filled locally, then we put those requests up to the state and even up to the federal level. So we have, for example, been working with a lot of our skilled nursing facilities, I think almost all of them, and they've been experiencing staffing shortages, which we've been assisting them with. Arrowhead Regional Medical Center actually has a list of staff that they can send if there's a very dire need and an immediate need. They can assist the facilities in that way and provide other resources. We have what we call the Skilled Nursing Outreach and Support Team, which goes to, I think they visited all of our skilled nursing facilities at least once, and especially when they're having test results come back, they are required to test their staff, all of their staff monthly. And now it's going to be even more frequent because Center for Medicaid and Medicare Services has come out. Since we're at around a 7% positivity, which requires testing staff once a week, and the state will be revising their guidance to go along with that, which puts, it is a significant burden on the facilities. In the beginning, we assisted a lot with, our public health lab assisted a lot with the testing. Now we've encouraged the facilities to set up their own testing arrangements, and the federal government is distributing some testing machines that can do testing on site and have a result come back in about 15 minutes. These are best for people who have symptoms in the first week of symptoms, but the facilities are all required to test even all their staff who have symptoms or not. So it is, for people without symptoms, it's not as useful to use that type of testing. So I think we also have a group that works with, as far as healthcare surge, we have a group that's been meeting for months. When our case numbers dropped, we had those meetings on hold, but we brought them up again for the alternate care sites. And right now we are just ensuring that we have everything ready in case we do have a surge. Fortunately, our hospitalizations they're about half of what they were about a month and a half or so ago. So that's been fortunate. I think that, and I think as far as working with public health and with the governmental agencies, I think the collaboration is the key in the communication. And I would hope we would not ever see each other as adversaries. I know that I'm grateful that in our county we haven't had as many issues with that as we haven't had issues as some other counties have. And so I think also wanted to mention one bill that I saw that I was excited to see was that actually was from Assemblymember Reyes, was AB 2147, and that was for firefighters, inmate firefighters who are now able to have their convictions expunged once they're released, and they're able to have a career in firefighting following the release, because prior, even if they worked in the conservation camps with firefighting during their sentence, they were not able to, because of their sentence and their conviction, they were not able to get a job prior. But this is going to be a great development, I think, for the firefighters to be able to have a career after they're released. I think it's the firefight. It's not directly related, but the wildfires, they are related also with COVID. We've had to, modify. Normally we'd have evacuation shelters, but it's not advisable to do that this year because we don't want any congregation of people in close quarters. So we've been setting up for the El Dorado fire, we set up an evacuation center, and the people would go and get a hotel voucher because we want to keep everyone from congregating. I know that there's issues whenever people are in close quarters with, even with other viruses like stomach viruses like norovirus. And so we did not want to introduce the possibility of a COVID outbreak. I think that's all. Those are the main things I wanted to talk about. But thank you for having me.
So Gary, let me jump in really quick. I was just going to say, Dr. Gustafson, I see there are a couple of questions for you in chat. Gary, if you're okay with it, why don't we hold those like we were planning until the end, so that everyone has a chance to speak, and then we'll present those to you as well, Dr. Gustafson, if that works. And I also wanted, okay, thanks. And I also wanted to mention Ruthie Argumedo is on the line with us, and Ruthie is Associate Vice President for Community Engagement at Molina Healthcare. And again, Molina Healthcare is our wonderful sponsor today, and we heard from Cameron Smythe. But Ruthie, could you give us a wave, and so we can send you some love?
Thank you. Great group. Happy to be here. Thank you.
Thank you for all your support, not just today, but ongoing. Molina and you have been amazing, so thank you. Okay, Gary, I'll shut up now. It's all yours.
No problem, Allison. Thank you. Thank you, Dr. Gustafson, for starting us off, for laying the groundwork about what's happening here on the ground. A number of things that the Department of Health, and in particular that your health orders, have had to consider and continue to adapt to the situation on the ground. And you mentioned also, of course, the wildfires that are occurring, and that just adds another layer of urgency and of emergency on top of what we have been experiencing. And I'm going to introduce our panel now. We have an extremely experienced panel, not only in their work in the current positions in government, but other positions that they've had in government and in the community. And the introductions I'm going to do are not going to do justice to their background and to their knowledge, but I'm going to do my best to give a very brief introduction of each. First, we have Congresswoman Norma Torres. She represents California's 35th Congressional District here in the Inland Empire. Of course, that includes Bloomington, Chino, Fontana, Montclair, Ontario, Pomona, Rialto. She previously served as a state senator and a state assembly member in our legislature, and as the mayor and city council member of the city of Pomona, so she understands issues from so many different levels and perspectives. Throughout her career as an elected official, she's worked to try to make government more responsive to the needs of the Inland Empire. And I should also add that she is also a member of the House Appropriations Committee. Commonly, as folks when you're in DC, you will hear an appropriator. So she, has a very important role in in the decision-making of Congress and how the funds are dispersed. I'd like to also introduce Senator Connie Leyva. She was reelected to represent the 20th State Senate District in 2018. She is serving her second term in the Senate, and her district includes Bloomington, Chino, Colton, Fontana, Grand Terrace, Montclair, Muscoy, Ontario, Pomona, Rialto, and the city of San Bernardino. She is also the chair of Senate Education Committee, if I'm correct. Please correct me if I misspoke, Senator. She's committed to improving California's schools, environment, and communities, as well as creating quality jobs throughout the 20th district in California. Believes that California families benefit most when we invest in and help strengthen businesses and other job drivers that create good paying jobs in our local community, and of course, help to reinvigorate our economy and our businesses in light of what's going on with COVID-19 and some of the impacts. And next, I would like to introduce Congressman Eloise Gomez-Reyes. She was elected to the state Senate in November 2016, represents the 47th Assembly District. So that includes the cities and communities of Colton, Fontana, Grand Terrace, Rialto, San Bernardino. You're hearing some commonality here. You're hearing what's we'll be talking about is working together. And of course, unincorporated communities such as Bloomington and Muscoy. Proud daughter of immigrants, she's been a champion in her community throughout her career. Commitment to civic engagement is a culmination built over years of experience. Goes back to her very humble upbringing as a young girl, picking grapes and onions in the fields with her family. Her determination, perseverance, and conviction to succeed has enabled her to be a voice for the voiceless and an asset to those requiring legal representation but are not able to afford it. She is also chair of the Human Services Committee and serves on the Assembly Budget Committee, which had a very heavy lift this year, having to make great changes since the original governor's budget was proposed. Of course, the pandemic hit, and for the first time in many years, all levels of government have had to deal with great changes to not only revenue stream, but demands that are required in a time of crisis as we have now. I'm going to ask a series of questions to our panelists. I'm going to ask you if possible, I know you have so much to say, such great insights and experience, but if you can, please try to limit your responses to 2 to 3 minutes. I'm going to pose the first question now. This will be to all 3 panelists, and we'll start, of course, though, with Congresswoman Torres. Can you just briefly, for everybody that's assembled online here, just review what your role in an oversight position is in your congressional role and for our legislators in their legislative role? What's the jurisdiction that you have as a member of an elected body?
Well, good afternoon, and thank you, Gary, for the question. Let me start by thanking every one of you on this Zoom call. I thought I was on mute. i.e. Chai for hosting this important forum and for Molina Healthcare for sponsoring this event. The reality is that COVID-19 is not an enemy that we can fight alone. We need everyone on this battle, from legislators to healthcare workers and everyday citizens practicing social distancing and wearing face coverings. Now, to answer your question, as a member of the House Appropriations Committee, which funds nearly all aspects of federal government, I have been at the center of the House efforts to combat COVID-19. Our committee spearheaded the most significant federal law to address COVID-19 pandemic, and that's the CARES Act. In that bill, we provided $175 billion for healthcare providers, secured $30 billion in additional funds for PPE and vaccine development, and authorized over $1 billion for community health centers, and provided $5 billion for community development block grants to cities and states to deal with this pandemic. These funds are directly supporting the Inland Empire, and as of today, we have delivered over $320 million in grants back to our district. You can go onto the website at torres.house.gov to see a map where the federal tax dollars are going and to help combat COVID-19. So these funds will provide an additional PPE for our hospitals, support staff at community health clinics. They will also increase affordable housing options and develop local infrastructure. We're not done fighting. Back in May, the House passed the HEROES Act to provide additional resources. And we're pushing Senate Republicans now to come back to the negotiation table to continue our obligation to support American people through this pandemic. So a lot of work ahead of us. We're going back next week to vote on other bills, and we're hoping to get back to the table and continue to negotiate on the next package.
Thank you. And Congresswoman, just if I could ask a follow-up, Allison, I hope you don't mind. Can you talk and the important work that you do on appropriations I mean, it's so important to have you there because you are able to look after the funds that come to the county and target it. But can you talk a little bit about oversight from a congressional point of view?
Absolutely. So, we have an oversight committee that was created just for the purpose of COVID-19 dollars that we're authorizing. But on behalf of our committee, each of the appropriators are uniquely positioned to come back with information and what we are actually seeing in the ground. I think many of you on this call received phone calls from our office, I think every single week, especially in the very beginning, dealing with what is it that you need, trying to get our hands around the needs assessment of every hospital, every clinic, every doctor office that was shut down, that were impacted by this. So, through this committee work, we work very, very closely together, the members, in small groups. So while the committee is huge, we work very closely on specific areas to ensure, number one, our local communities are getting exactly what they need, and number two, that funding is properly being spent. And that information then gets over to the oversight committee that will continue to investigate certain cases of abuse, for example.
Great, thank you. Let me turn to Senator Leyva. And Senator, if you can talk not only about oversight in general in the Senate, but especially in your role on the Education Committee, and there's so much discussion right now since the beginning of the school year, and the changes that have had to be made at the local level for education in the midst of this pandemic. And talk a little bit about oversight from that lens, if I may trouble you too, please.
Yeah, absolutely. Thank you, Gary. Thank you for having me. It's great to be here. We don't get to see each other in person, but it's really nice to be here on Zoom and see each other virtually. So I also sit on budget, and I sit on Senate appropriations as well. So, and also Subcommittee 1, which is what funds and education in the state of California. So let me just also say that the Senate did set up a special committee on pandemic emergency response and a budget subcommittee specific to COVID-19. And part of that is oversight with the governor's office. We gave him broad abilities just before the stay-at-home order was put into effect to spend money. But we also need to make sure that he's spending it in a way that the legislature thinks is prudent. So that work continues. We've had meetings during the legislature, and we will have more meetings in the fall. As far as education is concerned, I will try to stick to my 2 to 3 minutes, but there is so much there to cover. I think what I will focus on is the digital divide, and what a big deal that has been always, but certainly now with our students learning from home. I think the money that we're going to be looking most into and making sure it was spent accordingly is the $5.3 billion that the governor allocated to our school districts so that they can make sure that students have everything they need during this time of staying at home and working digitally and remotely from home. So most of that money, and I've had meetings with our district offices, and most of that money should be spent on devices or connectivity. So we partnered with Apple, and they have given us access to 1 million devices that come with 1 year of internet service. No district has an excuse not to purchase those because they have been allocated X amount of dollars in order to buy those. But we will be making sure that that money is spent on what we've asked the school districts to spend it on, because it's for our children, and we know that our children are our future. And if we don't take care of them, we've got to stop telling them that they're our future. So I will stop at that, Gary, because I want to be respectful of everyone's time, but I have lots more I could tell you about education.
Oh, I'm going to have more questions for you as well, Senator. So hopefully we'll be able to cover some of those thoughts in answering those questions. But let me turn to Assemblymember Reyes now. And from the State Assembly's perspective, from your perspective, also Assembly Budget Committee, Human Services, if you would as well talk a little bit about oversight and the jurisdiction that the Assembly has.
First, I want to mention something. Dr. Gustafson said that sometimes public health is seen as an enemy. I want you to know, Dr. Gustafson, not with us, because we absolutely value public health here at the state level. We want to always partner with you to make sure we get the facts to the people that need them. In the oversight in the Assembly, I'm so pleased to tell you that we've taken the lead from the Senate. The Senate put together this oversight committee, and it's something that the Assembly had been talking about, but it's something that we are now working to put together. Oversight is extremely important. Sometimes it isn't enough just to say we're going to allocate a certain sum of money, because if the money isn't spent wisely, it becomes an issue. And then we all, whether it's the Congresswoman, the Senator, myself, we hear about this. People are calling and saying, you said you're spending all this money, where is it being spent? We're not seeing any of it. On the oversight specifically, I think for me, one of the areas that we have most talked about, and I know that in the chat, somebody asked about that as well, is testing. We talk about the fact that we need to test more. We also need to test more in with our essential workers, with our frontline workers. We know that our people of color are being exposed, being infected more so and disproportionately. And that's something that has been of great concern. On the oversight as well, I want to tell you about the legislative proposals that were put in, our bills. We had so many great bills, I'm sure the Senator would agree. And we had to limit the bills that we did put in. One that the Senator didn't talk about was her proposal to have 6 months of PPE available before we send our workers in. Assemblymember Freddie Rodriguez as well introduced legislation that was specifically for PPE for our frontline workers. I want to also share that another proposal, another bill that I introduced was AB 685. We found that employers were not required to notify their employees when they were exposed to someone who had tested positive. It was recommended that they notify the employees, but there was nothing that required them to notify the employees. So AB 685 is on the governor's desk, and we're waiting for him to sign that. But it will now require that an employer notify all employees who have been in contact with someone who tested positive. In addition to that, if an employer has 3 or more who tested positive, it is considered an outbreak by CDC standards, and they would then have to notify the Department of Public Health within the county, and that county would then notify the state. I think it's really important when we talk about oversight that we look to the data. And if we don't have the data, then there's really no way to know where the outbreak is, or who's being infected more, who's not being tested, who is being tested. We have some counties that are saying that they wish that they could test more, or they wish that if they test more, that it isn't used against them when they start putting out the numbers of positives. And that's why Dr. Gustafson talked about the new way that we're looking at numbers of positives in comparison to how many tests there were. There are lots of things, and as the good senator said, we're going to limit our comments to make sure that we stay on within the scope of your 2 to 3 minutes, but we do have so much to share with you, and we do want to be able to take the questions from those who are attending. Thank you.
Thank you, Assemblymember. Well, let me pick up on something that you mentioned. You mentioned Senator Leyva's bill, and I think that that's a great segue to ask each of you to identify the ways that the county, state, and federal legislative bodies are working together or have tried to work together, and even the areas for improvement, what you're looking at doing, what you've learned to this point, so that when you're coming back into whether it's hearings now or potentially session renewing, or with Congresswoman Torres when you're reconvening next week. So let me start with Senator Leyva, and if you could address that, and then in series I'll go to Congresswoman and to the Assemblymember.
Yes, absolutely. So Assemblywoman Reyes and I have twice delivered PPE to our Arrowhead Regional Medical Center because we have had a huge shortage in the Inland Empire, and we have had to procure this. So I was happy to partner with her and make sure that we could do that, and make sure that our doctors, nurses, and everyone working at the hospital had what they needed. Additionally, we have the Assemblywoman talked about SB 275, which is on the governor's desk, and it's critically important that we are prepared when the next pandemic hits. This time, I would say we could give ourselves a little bit of a break. We weren't as prepared as we could have been, but shame on us if we're not prepared for the next one. And that doesn't just include our medical professionals, it includes our essential workers, our grocery store workers, our drugstore workers, folks who have not had a day off, well, maybe a day off, but they didn't have a stay-at-home order like many of us did. They've been on the front lines every day. So working together with our local officials, we have been able to do some really good things. And then things just are important, like making sure people can eat. I know that when we came home, I was incredibly worried about our food pantries. We reached out to all of them. We ended up buying $20,000 worth of rice to distribute throughout our food pantries. I partnered with the Assemblywoman and Assemblymember Rodriguez, and we have taken food to our healthcare workers and healthcare providers. We've just done a number of things to try, you know, you can't fix everything, but in my mind, we can make sure people can eat, and we can make sure we can help them put food on the table. So I feel like that we locally have worked together really, really well to take care of our communities that we represent.
Great, thank you, Senator. Let me turn to Congresswoman Torres now.
Let me make sure. Yeah, so, you know, in the beginning, my staff and I regularly are in conversations with our locals, local city councils, our counties, and our state representatives. Additionally, we participate in daily briefings with the governor's office and our counties. We use that information to compile and inform our residents through a newsletter that we publish daily. So we're trying to facilitate one place where people can go for all of the information that is published. And it's been a way actually to have a bit more transparency, to be able to look at everything and see where the discrepancies may be. In fact, just this week, you know, we announced over $6 million in new community development block grant funding for the district. Our cities were shocked that they were receiving this additional funding because they didn't know that it was coming their way. But it's not just money and resources flowing from DC. The key to battling this pandemic is to have the transparency and constant flow of current information, real-time information that is from trustworthy sources, like our medical providers. So for example, when the pandemic began, we immediately contacted all of the clinics and hospitals, and we heard directly from them that they did not have the appropriate PPE, like gloves and masks and gowns. The Strategic National Stockpile is the federal government's source of PPE, which is distributed to state governments on down to the county and then health facilities. But that wasn't enough. So when our hospitals began to complain about that, our office would reach out to our county, our prospective counties, and highlight the concerns daily on the call that we were on with the governor, and push the U.S. Secretary of Health and Human Services to get those supplies to the hospital. So it was a coordinated effort, hearing directly from our hospitals and community clinics, then us taking that information to the counties, to the governor's office, and also to the U.S. Secretary of Health and Human Services. I think that coordinated effort really helped move supplies around. We were able to help them coordinate themselves and balance when one clinic or one hospital received more supplies that they needed, for 30 days. They would share that with other hospitals. So I thought that was the best way that my office could help them was to communicate with everyone and bring them all to work together. So another example of how our work intersects is unemployment benefits. I led the charge in Congress to ensure that independent contractors were included in additional unemployment benefits during the pandemic. Since the California State Employment Development Department oversees dispersing of the payments, my office regularly helps constituents by communicating with EDD to ensure that everyone gets what they deserve. We hold the state accountable to ensure that my constituents receive those payments. Without coordinating between the state, county, and our local partners, the system simply doesn't work. So I think it's important that every effort from every person in our community is recognized for what it's doing, and that's helping to deliver the healthcare that we need in our community.
Great. Thank you, Congresswoman. I'm going to come back to a point that you mentioned that I wasn't aware of. I'm going to come back to that in a moment. And it has to do with the relationship between the governor's office and California's representation in Congress. But I want to turn to Assemblymember Reyes for a moment and allow her the opportunity to address this cross level of government working relationship.
First, something that the Congresswoman talked about at the onset is about the CARES Act. That was probably the most important thing that could have been done. And I want to publicly thank her and all of our local members of Congress and Senate for having the courage to fight so hard to make sure that that money did come to our communities. That was essential for all of us. And as the senator talked about some of the ways that we have partnered, it's a labor of love. My staff has been, as the senator staff, we have partnered on so many of these events, giving out food, where we just start advertising, and we partner with Community Action Partnership and some of the others who can provide the food, because we have to make sure people do not go to bed hungry. That's really important. And finding ways to partner with each other and partner also with other organizations in the community. Our nonprofits have been extremely important in this regard as well. At the beginning of all of this, when we were sent home on an early recess, what I did at the very beginning, within the first week, is I scheduled appointments with other elected officials and also with all of my city mayors, every city manager, every fire and police chief, every school superintendent, and the chamber presidents. It was really important for me to be able to say truthfully that I had reached out to them at the very beginning to see how my office could help. At the state level, we have access to things that our local people would not have access to. And for them to know and to hear from us was extremely important. That is something that we try to continue to keep up, since this has extended a whole lot more than we have expected. I think the bipartisan togetherness in this is extremely important as well. It isn't for one side of the house or the other, or the majority or the minority. This is the entire community coming together to make sure that our communities are taken care of, and to make sure that our communities know that they can call on us. It was mentioned earlier about unemployment benefits. I think my office is receiving more unemployment calls, more EDD calls than any other call. And it's true for all of my colleagues, because it's something that is something concrete that the people who have been working all these years, many of them have not ever asked for any benefits. This is the first time they're doing it. Another thing that we're doing is town halls. I'm not the only one. My colleagues have done those as well, both the Congresswoman and the Senator. But the town halls that we hold are also extremely important. We have experts come in and talk about help for our small businesses, help for food giveaways. We have on criminal justice. Whatever the issue area is, we've all done town halls, and that's extremely important. Earlier, I talked about Senator Leyva's PPE program. The other bill by Senator Rodriguez is AB 2537. Another one that will require hospitals to maintain a supply of PPEs for future use as well. The other thing that we have done is that we have, every September, we have our Senior Advocacy Week. For an entire week, we visit senior centers throughout the district. Clearly, we can't do that this year. And so we have taken hygiene kits to our local senior centers to make sure that they have access to these things. they may have food, but they don't get access to hygiene products. So again, I've partnered with Senator Leyva and other local elected officials to make sure that we deliver these to our senior centers. Senator Leyva talked about the mask. We have N95s and surgical masks and the shields that we partnered with Senator Leyva, Assemblymember Rodriguez, Assemblymember Ramos, also with San Bernardino Community College District, which is, they're the ones that are making these face shields as well. It's their 3D program. So, and the Inland Chinese Association also partnered with us. We need to do all of these partnerships with community groups and as local officials representing this area, the people that voted on us, the people, even those who didn't vote for us. If we represent them, we have to truly represent them, make sure that we bring all those resources to our community and make sure that the community knows that these are available.
Great, thank you, Assemblymember. Thank you for mentioning the 3D printing. That was something that it's the back of my mind, and so important that you and your staff had helped to access with the help of other entities. Congresswoman Torres, I want to come back to what you mentioned about the briefing from the governor. You know, so often we think about that the governor relates to the president, but we also, it's so important with such a robust and energetic California delegation that we have representing us in Washington, that there be that interaction with the governor, who of course is alongside of the legislature, has an important role in policymaking, but also has so many of the executive offices, the departments that help to make the programs run and help with the response, not only the governor's office of emergency services, but California Department of Public Health and others. Can you talk a little bit more about that relationship between Congress and the governor's office, especially in times of crisis like right now?
Absolutely, Gary, and I have to just share with with my colleagues that are here, state representatives, that the governor's office has been incredibly responsive to everything that our congressional delegation has sent his way. He has, joined us on numerous calls to brief us personally on, where he is going on certain issues that we have had, the concerns that we have had. For example, the prison here in Chino, I was able to directly communicate with him about those issues and those concerns. Unfortunately, the prisoners were taken or moved to another prison instead of dealing with the situation here. But I would say that Governor Newsom himself and his staff has been incredibly accommodating with a number of inquiries that we have sent their way. And personally from our office, sharing with him directly about the needs, the shortages in protective equipment, and working with our local manufacturers. The county of San Bernardino, I can't speak enough about the county of San Bernardino and how responsive they have been with my office too, from providing a list of manufacturers that we can make cold calls to see how we can help them switch to manufacturing the PPE equipment that we needed, that our workers needed here in our community. In the beginning, if you recall, there was nothing, no hand sanitizer, no hand wipes. Our first responders didn't even have any of that information. I had folks in law enforcement come from 60 miles away one way to Pomona to pick up a 2-3 ounce bottle of hand sanitizer. I mean, not just one bottle, cases of them, but that's simply because they could not find it. It wasn't an issue that the state couldn't provide, that their city couldn't provide. It was an issue of lack of supplies here. And we shared, our office shared that information with the governor. And he responded. So I'm very, very happy at the response that we have received from him. The other thing I want to mention is how incredibly grateful that I am to all of our local manufacturers who really answer their call to duty during this time in our communities.
Great, thank you, Congresswoman. And I want to turn to Senator Leyva and to Congresswoman Reyes now to talk also again about relationship with the governor's office, and not only the governor's office, but the different departments. And I mention this because right now, of course, post-legislative session is the time when the governor is deciding whether to sign or veto a number of bills that the legislature had passed. I don't necessarily want to put you in the position of having to weigh in on specific bills, but just talk about that relationship and the importance of the legislature and the governor working together, and how you've been able to do that, not only during this crisis, but as each of you alluded to, you're in a different situation where you're not able to have a conversation necessarily as you normally would in the Capitol.
So I would say that the governor's office is very responsive. The governor himself is very responsive. And it is very different to not be at the Capitol and just be able to walk on down and say hello or address your issues. But that's why you have people's cell phone numbers, and you can text the governor, and he's very responsive. And I think he and his office have, anytime we've asked them for something, if it's something maybe we felt did not think about or they had overlooked, they have been great about responding. The one thing that I specifically worked on, and so did the Assemblywoman, was the Child Care Task Force. So as the chair of the Women's Caucus, and certainly the Assemblywoman as a member of the Women's Caucus, we know that people can't get back to work. Women especially can't get back to work if they do not have a safe place, an affordable place to leave their child. So when we reached out to the governor's office, he said, oh my goodness, of course. He put together a task force. I think there were, I want to say 7 of us from the Women's Caucus that was on it. We met weekly. He also put together a guidance plan, which we just, I'm going to ask Eloise to help me. I think we got the update on Friday from his office and the part of the task force. So he's been very responsive. And I would also say that, the longer you do things in life, the more relationships you develop. So he has put a lot of great people in his office that I've known for years. So you can just reach right out to them, call, text, and get the answers that we need for our constituents. So I feel like the governor's very responsive to all of us.
Great, thank you. And Assembly Member, your thoughts?
Well, the senator didn't talk about this, but the senator had a great relationship with the governor before he became the governor. She brought him into our community before he was the governor. And those relationships make a big difference. Yeah. I just reposted those photos from before his time as governor, and so I was reminded of that. Those relationships are extremely important. Yeah. The constant communication with his office, making sure that he hears what the Inland Empire needs. So he's hearing it from our congressional delegation. He's hearing it from Senator Leyva, from myself, and from all of our other colleagues there in the state Senate, in the state legislature. He knows that the Inland Empire is on the map. In fact, he has one of his senior staff members is from the Inland Empire, and we always love calling on him. Yes. But it's wonderful to know that we can call him, that we can text him, and that he will respond. The child care issue that Senator Leyva talked about was an issue that the Women's Caucus had as a priority. And when the governor met with us as the Women's Caucus, recognizing how important it was, he responded to the senator and said, let's put together a group that will meet with me regularly. And it isn't a group that meets with a staff member, it's a group that meets with him regularly. And that makes a difference. With the Latino Caucus, of which I'm also a member, we also have had our regular Zoom meetings with the governor as well on our priorities. And a big issue, of course, has been the disproportionate number of positive COVID results for people of color. our Latino frontline workers, African-American frontline workers. These are issues that if the governor doesn't hear from the caucuses, maybe it's not going to be something that's going to be brought to the forefront. But again, because he takes the time to meet with the Women's Caucus, the Latino Caucus, and other caucuses, he gets to hear from us directly. The fact that we also can call the secretaries, whether it's social services or whichever department, to be able to reach out to them and tell them, just as the Congresswoman was talking about, to be able to ask them directly, who is in charge of this particular issue? It's a concern in our community. We need to have an answer. To have that access makes all the difference in the world. It doesn't just happen because we want it to happen. It happens because we build those relationships. Yeah. I am now in my second term. Ours are 2-year terms. I wish I had that 4-year term like the senator, but I'm like the Congresswoman, it's every 2 years. But now I'm in my second term and hopefully going into my third term. Relationships with those who can help our community are extremely important, not for our sake, but for the sake of our community. When our community asks us for help, we need to be able to respond to them. And the best way to respond is by getting the answer from the very person who has the authority to give us what it is that we need. So those relationships, I'm glad the senator talked about that, because those are extremely important.
Excellent, thank you. You know, you alluded, both you and Senator alluded to the fact that the portfolio of bills that you would normally carry was much reduced this year. And I want to now ask for your thoughts. You've gone through the, and I know I'm not giving you any break. The legislative session just ended. And here I am about to ask you about your next legislative priorities, but really with the ongoing crisis, you've identified certain needs or certain thoughts and certain concerns. And I'd like for you to share what those concerns are, whether you have an idea for legislation or not, but what are the ongoing concerns that you have about COVID-19 now and in the future. And then I want to come back to the Congresswoman, while Congress is still in session and there's still a hope that additional bills and other responses will be passed. But I want to focus on the legislature for the moment, looking ahead.
So as the Assemblywoman said, we all had to par down our bills, which was very difficult. When I was first elected, people said, don't fall in love with your bills. And I tell people, no, you have to fall in love with your bills, because if you don't love them, how can you shepherd them through? So to shelve really a lot of bills that I felt would be wonderful, not just for the state of California, but also for the Inland Empire, was difficult, but the right thing to do, because we cannot be tone deaf to what's happening right now up and down the state of California. And for me, looking forward, and even this year, it's about healthcare. Before I ran for office, when I was with the labor movement, I negotiated benefits for my 5,000 workers and the 120,000 folks that we represented in Southern California. And so healthcare has always been a passion of mine. When I was leading my local, we were navigators under Obamacare, and we signed up 500 community members, because access to affordable healthcare just has to be paramount in all of our minds. So I think we need to continue to work on that. And then the cost of healthcare. Real wages have not risen in California for decades, but everything else goes up around us: housing, the cost of healthcare, the premiums. So really looking at real wages. And then also, I called on the governor the first part of June to declare racism as a public health crisis. I think that is huge. Until we fix the racism that exists in California, in the country, in the world, and I'm speaking specifically to the Black population, until we fix that, we don't fix anything. And after I called on the governor to declare racism a public health crisis, I also followed up with a letter from 14 other senators asking him to do the same. He has not responded yet, but we will stay on him. We know that the county of San Bernardino and many other counties have called racism what it is, a public health crisis, because it affects people of color in so many ways. So I think those are some of the things that we'll continue to work on in the coming year. And candidly, we have a little list on Team Leyva of legislation we'd like to introduce, and we kind of try to prioritize things. So we'll be working on things throughout the fall, so that we want to introduce things that maybe would have been different a year or 2 years ago, but there's more critical issues and things are more highlighted now. So this is what the fall is for, is to figure out what we need to do for next year. And a lot of that will be determined by what happens in November. If we actually get a president who cares about people and who puts the pandemic at the forefront and has a national plan, that would help all of the states to be able to do a better job. So we're working on what we need to do next year.
Great, thank you, Senator. As some member, I'm interested to know what's on your list. What are the things that are concerning you, and then we'll come to the Congresswoman.
Before I tell you about what I want for next year, I just got a text message from my staff. The governor just held a press conference where he announced that he had signed AB 2147 for firefighters. I'm very happy that I had received a text earlier yesterday, but it was confidential, so I couldn't talk about the fact that he was.
Woohoo!
Yes.
That's great.
So and my staff says he gave me a shout out, so I'm always happy about that. But for next year, I agree with the senator. It has to be about healthcare. There have been some attempts to provide healthcare for all, and there are lots of ways of doing that. I know that we did have legislation last year to have health care for everyone up to 26 without regard to immigration status. There was a proposal this year and last year from Senator Maria Elena Durazo for health care for our senior citizens without regard to immigration status. And although the governor had initially said that that was something he was going to be working on, because of our budget crisis, it wasn't something we were able to take care of. But ensuring healthcare access for everyone has to be a top priority. And it's something that I know has been, I'm not trying to make this a one party or another, but it has been a top priority for Democrats of the legislature for several years. And I think that another thing also is that because of COVID, so much that has been talked about in the past has come to the forefront. And I mentioned this earlier, that we know that our communities of color struggle more because of healthcare needs. And when we look at outcomes for communities, we have to keep in mind that there are some disproportionate problems in our communities of color. If we're going to provide health care and health resources, we can't treat everybody equally. There has to be equity. We have to bring everybody to the same level before we start bringing everybody up to the next level. We have so many that are disproportionately not treated. We have healthcare issues especially for our communities of color, and those have to be addressed. I'm so glad that Ruthie is on this call from Molina, because their commitment to taking care of our communities and their outreach to communities of color is something that I think that they have to be our mentors in this, in the way we do things. So when we look at healthcare access, we also have to demand the positive healthcare outcomes, especially for the unique needs of our community. I want to also take this time to talk about another bill it just so happens Senator Leyva and I are joint authors on this bill, and it's about lead poisoning of our children. We know that under federal regulations, our children are supposed to be tested twice by the time they're 2 years old. And I had a bill last year, or the year before that, and Governor Brown vetoed it and said, no, the Department of Public Health here in the state of California says that they're already doing all that testing. So what did we do? We asked for an audit, and the audit came back confirming what we had been saying, that the doctors, that the medical facilities were not testing our children for lead poisoning. We have millions, 2.5 million children who have not had the testing as required. And so the bill, once it's signed by the governor, will require that we do what we're supposed to do, and also provide the needed attention to those children who do test positive for lead poisoning.
Wow, thank you. something that I hadn't thought about. Thank you for bringing it up, for mentioning that, for all those insights, Assemblymember. So Congresswoman Torres, you mentioned that you're going back in session. What session continues? You may have had a week off, but you're going back in next week. There are some votes that you'll be taking. What's on your mind? What are you focusing on about COVID-19 now going into those discussions and those floor debates next week?
Yeah, thanks for the question, Gary. I just want to be clear that, you know, our legislative sessions have continued. It's just how we work is a little bit different. We decided to do all of our work, whether it's virtually or have some committees are requiring their members of Congress to actually be present and be at the Capitol. Most of the work that I do on the Appropriations Committee has already been done as it relates to our funding bills. We did that at the U.S. Capitol through those committee meetings. But, you know, we continue to work remotely through Teams meetings and other types of platforms that we utilize. I would say that, you know, regarding legislative priorities, I hear, you know, from my constituents every day how this pandemic is hurting them. The brutal reality is that the pandemic will have lasting impacts on our community and our health. And unlike the president, I know that the virus isn't going to magically disappear. I've been on numerous conference calls with Dr. Fauci, where he has expressed optimism that we will have a vaccine by the beginning of next year. However, public confidence in the vaccine has been undermined, as many of you on this call already know. We can't have politics distort science and public health. The public needs to know and needs to be reassured that a vaccine is safe and that vaccines are effective, particularly in communities of color, where there has been more historical distrust of government health programs because really they have not worked for them. So as I mentioned before, people are still hurting from the economic impacts of the pandemic, and it's critical that we pass a funding package to provide much needed relief for our constituents. So right now, the House has passed the HEROES Act, which was a $3 trillion stimulus bill to help those in need. And that passed on May 15. This includes $1 trillion of funding for state and local governments. I've had many meetings with our city officials over the past several months. We log on and listen to their city council meetings also. So whether the budget crunch this year or next year, everyone is very concerned because they're either heavily dependent on sales tax or heavily dependent on property tax, or sometimes they're heavily dependent on both mostly. So the tragedy is that it's not their fault that their budgets are suffering. Many of our local governments have had rainy day budgets, funds in cases to utilize in case of an emergency. So they didn't anticipate, though, you know, this historic recession or the magnitude of this pandemic. That's why Congress needs to send relief. So I would say my very, very top priority right now is to ensure that that we continue to work on a relief package that we can deliver, not just, you know, for our citizens, but also to our state and local governments that are very much on the front lines of providing the relief with the funding that the federal government has sent.
Great, thank you, Congresswoman. And what you alluded to also, to start out this particular answer, was not only are you active during a district work period and working in the district, but you kind of did double duty because now you had the normal meetings that you may have, whether formal or informal in DC, and you had to layer those electronically on top of what you're doing with your staff out in the district. So.
Absolutely. You know, I want to mention from the start of this pandemic, or from, you know, March, the beginning of March, when we came back from DC, and our communities were shut down. We started in my office a document documenting every phone call, casework, all of the work that we've been doing. To date, from March to now, that document is close to 1,500 pages long. But in there, it's the roadmap that we have taken, and it really shows, the dedication of my district staff that has really been working incredibly hard alongside me and my DC office to ensure that our constituents have what they need, and they have real-time information about what's available to them.
Wow, that's an incredible list. I have so much more I would ask about that. I have other questions here on my list, but I know that we had questions that are being posed in chat, and I want to carve out some time, a limited amount of time that we have left. I'm going to turn it over to Soteria Cobb from the Medical Society to help facilitate those questions that other attendees have.
Hi there. Okay, I have just a few questions. Our first question is from Dr. Sakira, and it says, I wanted to ask the panel what the bottleneck is for testing. We have a critical need to routinely test all of our frontline medical workers, from paramedics to the emergency departments, who are exposed daily to COVID. We are limited to testing only symptomatic individuals. Also, what are we doing for testing and education of our at-risk communities of lower income and communities of color? And Dr. Gustafson, would you like to address this?
So, prior, the bottleneck had been the testing turnaround time. I think we're doing a lot better with that now. We have a contract with the new Fulgent testing lab, which has been giving 24 to 48 hour turnaround time. I think we have been working with Native Hawaiian, Pacific Islander, and African American populations to set up the mobile testing events. And we've been talking with them about how we can address the cultural competency and equity issues. But as far as the bottleneck currently, I don't know that in San Bernardino County we have a bottleneck. We have a lot of availability of testing at our community testing sites. We have 10 of them. And as I mentioned, we're using the Fulgent lab with 24 to 48 hour turnaround time.
Anyone else who wants to jump in on these answers, please feel free. This is, unless they're specifically directed to someone, you're all welcome to weigh in.
This is Eloise. I will share that with foster farms, we all know that they were shut down after 8 people died and hundreds tested positive. When we were talking about my bill, AB 685, one of the discussions that we had with the governor's office is that it goes back to the very same thing, that it's not going to matter if we say, if your employee, who tested positive, then everybody who comes in contact has to be told. Well, after they're told, then what? Because if it can't be tested, that becomes a problem. The governor did make, at that point, made a commitment for those working in the fields, because it's a little more difficult to get tested there. So they will be sending out mobile testing if somebody tests positive with rapid results. It makes it difficult, like here at the county, I really appreciate Dr. Gustafson with all the efforts they're trying to do, trying to be as nice as possible about what they say. And the bottom line is, get us the test and get us the ability to get results quickly. And we aren't there. And that is something that I will tell you that I know personally for myself and for the rest of my colleagues, our frustration has shown vividly with those in leadership that this is an issue that has to be addressed and has to be solved.
Yeah, may I speak? Just as an emergency physician, both at Arrowhead Regional and at St. Mary's and High Desert, I can tell you that we just do not have enough tests. Our people are going on the line. We're exposed every single day to COVID. We have people who have COVID pneumonias, et cetera, and we can't even get routine testing. We need to take care of our healthcare workers. We have emergency physicians and paramedics who are isolating themselves from their family because we can't routinely test them. And I wanted to thank you so much for the efforts in getting us PPE, because we were having to take our N95 masks and recycle them, and we would only get one new one every week, which is crazy, seeing how many patients we see. And yet any exposure to COVID is an indication for testing, and yet we don't routinely have enough testing to be able to just, every healthcare worker needs to be tested once a week, I think, because we are going and seeing non-COVID patients too. So if we are one of those 25% of patients that are asymptomatic and we're exposed every day, if we aren't testing our healthcare workers routinely, at least once or every week or two, this is a very important part of controlling this thing. So, and thank you for all your efforts, and I really appreciate your reports and all the efforts that you guys are doing.
We appreciate you. Thank you. And to everyone that you work with.
And I think that, if I may, it's clear that the next Zoom call we have with the governor, we're going to have to emphasize this more and talk about this Zoom panel that we were on today. I know that this is going to be top priority.
Okay, so Maria, let's do our next question.
Okay, perfect. The next question is from Stephanie Congdon, and it says, what extra support is the state giving to help parents of children with different abilities in distance learning? They are really falling behind.
That is a great question. And we worry a lot about our students with IEPs, our students that have special needs. And I will tell you, I wish I had a really great answer. There is new guidance, and that guidance supplements the existing guidance as far as small cohorts and bringing those children back to school. Each school district has to maintain a learning continuity plan and an attendance plan. They have to still follow the IEPs that each child has. But I have to tell you, there's a lot of debate, which you may or may not know, with bringing teachers back safely, with bringing children back safely. Literally almost daily, the situation is changing. But we are monitoring closely. And when I say that, I mean us on Senate Ed, because my education staff knows that this is very important to me, because I worry about loss of learning for every student, but especially for our students with special needs. So it's a moving target. I think we're trying to do it right. But if you have any specific things you want to see us do, please let me know, because we are always looking for, I wouldn't say the silver bullet, but good ideas.
Great. Well, thank you. Our next question, which was already answered, it's from Dr. Michael Secura. It's, what do we do for the evacuees from our local fires with regarding to PPE, social distancing for COVID control? Dr. Gustafson did answer and said, for the fire evacuees, she mentioned in her remarks that the county is providing hotel vouchers instead of shelters. Does anyone else have anything to add to that?
I don't have anything to add. I mean, it's a big concern, and it's something we have to continue to work on.
Great. Well, thank you. Our next, it's a comment from Dr. Michael Secura. Please don't forget our other huge public health crisis, the opioid crisis.
Oh. Yeah.
We have data that overdose deaths and rates of opioid and amphetamine use disorder are on the rise again during this COVID crisis.
Yes, and go ahead, Assemblywoman.
I wanted to say that I have a bill that was sponsored by the California Attorney General, AB 6. It was a gut and amend, and those are always more difficult bills because it's something that our colleagues didn't have an opportunity to look at over a period of time. But what this bill would have done is that it would have given the authority to the Attorney General to finally enter into that settlement with the opioid manufacturers to the tune of, I believe the number was $3.2 billion. We have a number of counties that have already filed lawsuits against the manufacturers. Of our 54 of them have filed lawsuits. I was happy to see that San Bernardino and Riverside both were included in there. A number of cities also filed lawsuits against the manufacturers. Our cities had not done that, San Bernardino or Fontana, which are the two largest cities here in our county. But that would have allowed the Attorney General to reach an agreement, allow each county and city to continue with their lawsuit if they didn't want to be part of the distribution. But unfortunately, it didn't make it past the legislature, so we couldn't get it to the governor's desk. We will attempt this again in January because we have to be able to settle with those manufacturers and start getting the money in. The way this was supposed to be is that 15% would go to the cities and counties, 15% of that settlement would go to the state of California, and the other 70% would go to the entire state to be divided in a way that took care of the prevention and the treatment and everything having to do with this opioid crisis that we have suffered through for years now.
I want to add that in Congress, we've taken a lot of steps. This is one issue where our Republican colleagues are, very much in agreement to provide relief to our communities and financial assistance to help those that are addicted get the help that they need. I used to say, in the Inland Empire, we're too poor to afford, these prescription drugs. And, many of our insurance plans that we traditionally used to have simply, don't cover or come with a copay that, folks simply can't afford. It is a problem in the Inland Empire, but I'm still very much more concerned about meth and crack cocaine in the Inland Empire. As I continue to discuss this issue with law enforcement, those are the two types of drugs that they continue to see every single day and continue to see the impacts of overdoses in our hospitals. So, and I don't have the numbers, I apologize for that, but in the CARES Act, we added money for mental health, which is, for addiction services. And also in the HEROES Act, we added funding for that. So we'll continue to negotiate to try to get more money into our communities.
Great, well, thank you. And our last question and comment is from Dr. Christy Roloff. And it states, we appreciate everything the panelists have done to get PPE and testing out to our community. The reality, as Dr. Sakira alluded to, is that we have fewer test kits available at our county safety net hospital than surrounding private community hospitals. This exacerbated our healthcare disparities. My question is, what will you do differently when it comes to distribution of vaccine, when it comes available to ensure we do not further separate the haves from the have-nots?
You're on mute.
Sorry, I was on mute. Ensuring that everyone, is able, who especially our frontline workers. In Congress, this is an ongoing conversation that we've been having, with our speaker and the leadership in the Senate on the Democratic side, is that, you know, we have to make sure that the people that are working directly, whether it's in healthcare, whether it's our grocery clerks, you know, whether it are the people working in farms, or, you know, critical workers that are required to go to work every day from day one, the beginning of this pandemic, are the first ones to get this vaccine. We'll continue to push back to ensure that a safe vaccine is available, one that is not driven by political decisions or political influence, but is delivered by, you know, with the advice of science, and our health providers can guarantee in our communities that this vaccine will actually help. But we will continue to update you on all of those efforts. We've written several letters. You know, we have introduced some legislation that covers that. But ultimately, we know how games are played. And for the Inland Empire, a community that is made up of, you know, has such a large footprint of logistics, workers that work within the logistics industry, we want to make sure that those people, you know, have a way to get that vaccine, are able to get it, because the work that they are performing every single day is beneficial, not just to the immediate community here, but to the entire U.S., as much of the goods that come in through the Port of LA and Long Beach end up not just in the Western states, but throughout our country.
I want to add also that we know we didn't get this right. We know that we feel that we're not getting our fair share, and that has been part of our discussion with leadership. If so, Christina Roloff and Dr. Segadia, if you'll give us the numbers, we'll still continue to say we're not getting our fair share. But if you have numbers on the comparison, that'll help us with our message saying, this is where our community did not receive their fair share, and we want to make sure that that is not repeated. I would welcome that. I'm sure the rest of my colleagues on this panel would welcome that as well.
I would just say we also have to make sure in the efficacy of the vaccine, and make sure that the public actually believes in what they're getting, and then we make sure that our essential workers get it first.
Yes.
Okay, Gary.
Sorry, I was on mute there. Thanks, Allison. I know I'm going to turn it back to you in about 30 seconds to close everything out. I want to thank our representatives, Congresswoman Torres, Senator Leyva, Assemblymember Reyes. Thank you for making the time to be a part of this. But I also want to compliment each of you, because you three have outstanding staff. Before the pandemic, I would hear from them, and I think just about most folks on this event know your staff and have heard from them because of the outstanding work that they do on behalf of the community, and even just as much so even after the pandemic. And I think it's a credit to you in your leadership and understanding and finding the right people that connect with the community, and finding people that are dedicated and working on your behalf and on the community's behalf. So a shout out to your staff.
Thank you.
Thanks, Gary. And actually that was a lovely, we make a good team, Gary, because you covered a lot of my closing. So that was, because
didn't mean to steal all that, Allison.
No, you didn't at all, because the thank yous are something we need to emphasize, and it should be said multiple times. So, you know, I do want to say one of the most inspirational things I heard come out of the discussion today, though, was the emphasis on bipartisanship and collaboration, and that's much appreciated, you know, because I think again, this spirit of camaraderie and collaboration is going to be essential to move forward. And I know it's something you deal with intensely in your policy making arenas every day, and it can be very frustrating, but we thank you for you know, staying balanced and level and representing all of us so well. So again, as we close out here, we're just a couple minutes over, so I'm going to be 30 seconds myself, but we just want to thank Molina Healthcare again for the tremendous sponsorship and support of this event. And thank you, Cameron Smythe, Ruthie Argumedo, and Alexandra Bravo and your entire team for all you do for us, including a lot of PPE distribution, which has come through the Medical Society and other entities. So Molina, we thank you for that. Again, I'm going to reiterate this. We want to thank our speakers and our panelists, Dr. Erin Gustafson, Congresswoman Norma Torres, Senator Connie Leyva, and Assemblywoman Eloise Reyes. And you know what? Not only thank you for being here today, but thank you for your commitment and your passion and your leadership, particularly in the healthcare arena. You have to represent so many different interests from so many different constituencies, but what you do for healthcare and not just coverage, but actually ensuring people receive the care. Coverage and care are often two different things.
Yep.
That's huge, and we are grateful to you. So thank you for being so passionate and caring about that. And it comes through in everything you all do. So we're very lucky to partner with you. And I also want to reiterate what Gary said. Thank you to all of your staff, just such amazing and thorough and responsive staff members. So thank you, all of you. I want to thank our SBCMS staff for helping with all the technical aspects of this. Janice Solorio, Soteria Cobb, and Debbie Long. Thanks, guys. And I want to, of course, thank Gary Rotto for doing a yeoman's job and then some in stepping in to MC and facilitate today for Supervisor Manny Perez, who we hope is on the road to recovery with his illness today. We want to remind you that we look forward to seeing you at our next IECHI Quarterly Health Education Forum, which will be Tuesday, November 3rd at 12 noon, another virtual event. We will be developing our theme soon, but please check our IECHI Facebook page as well as IECHI.org website for those announcements. And the more likes we get on Facebook, the more we can circulate our message and share this valuable information, including the recording from today's session. So thanks, everyone. We're going to let you go now and have your afternoon back. Thank you all for all you do every day. And we will see you soon.
And a thank you to Victoria Stephen, our fantastic executive director, for helping to make us all look good with all her great background work.
Thank you. Thanks, Gary.
Everyone.
Bye-bye.
Stay safe, everyone.
Bye-bye.
Bye.